In this video, I'm going to show you how to reverse gum disease at home, using 14 natural remedies. And, if you stay until the end of this video, I will share with you a 60 seconds dental trick many people are starting to use before going to bed, to rebuild their teeth and gums and even get rid of tooth decay. And as an extra bonus, you will see 2 very useful and effective tips to reverse gum disease focused on curing gingivitis and periodontitis. 1. Oil pulling. In a 2009 study trusted source, the Ayurvedic practice of oil pulling showed a reduction of plaque in individuals with gingivitis. Swish a tablespoon of a high-quality coconut oil around your mouth for about 20 minutes. This swishing pulls the oil between your teeth. Then spit the oil out, rinse your mouth with warm tap or saline water, and brush your teeth. The traditional oil to use for this technique is sesame oil. But 2012 research on tooth decay from Athlone Institute of Technology indicates that coconut oil may prevent the Streptococcus mutans bacteria from damaging tooth enamel. 2. Eucalyptus oil. According to a 2008 study, eucalyptus oil is an anti-inflammatory germicide that may treat receding gums and stimulate the growth of new gum tissue. 3. Salt. For use as a bacterial agent, and for soothing gum inflammation, a salt water rinse could be effective. This is how you can prepare it. Thoroughly combine 1 teaspoon of salt in 1 cup of warm water. Rinse your mouth with this salt water mixture for 30 seconds. Spit out the rinse, don't swallow it. Repeat this 2 to 3 times a day. 4. Green tea. According to a 2009 study trusted source, drinking green tea can help promote healthy teeth and gums, and may actually ward off disease. 1 to 2 cups of green tea daily could make a huge difference in your gums. 5. Peppermint essential oil. According to a 2013 article trusted source in the European Journal of Dentistry, peppermint oil can be effective in preventing the growth of disease-causing microorganisms in the mouth. 6. Aloe vera. A 2009 research showed that aloe vera can be effective in promoting oral health, and this is how. You have to inject medicinal-grade aloe vera gel into inflamed gums, resulted in improvement of periodontal conditions. 7. Septilin. Septilin is a proprietary multi-herbal preparation of guggul, gotuchi, licorice, and other compounds. A 2014 clinical trial, published in the Journal of Periodontal Implant Science, suggests that taking septilin improves periodontal treatment outcomes. Septilin is available in both tablet and syrup form. The recommended dosage for adults is 2 tablets, taken twice daily, or 2 teaspoons of syrup taken 3 times a day. 8. Omega-3 fatty acids. A 2014 clinical research concluded that 300 mg of omega-3 fatty acids, taken daily for 12 weeks, can reduce gingival index, while improving gum-to-tooth attachment. Gingival index is a measure of the severity of gum inflammation. 9. Tea tree essential oil. A 2013 article in the European Journal of Dentistry concluded that tea tree oil can be effective in preventing the growth of disease-causing microorganisms in the mouth. 10. Turmeric gel. Turmeric contains curcumin, which is recognized for its anti-inflammatory and antioxidant properties. According to a 2015 research, turmeric gel could possibly prevent plaque and gingivitis, which can contribute to receding gums. 11. Hydrogen peroxide. Rinsing with a solution of water and hydrogen peroxide may help treat sore, red, or swollen gums. To use hydrogen peroxide as a natural remedy for receding gums, you can do this. Combine 1/4 cup of 3% hydrogen peroxide with 1/4 cup of water. Swish the mixture around your mouth for about 30 seconds. Spit the rinse out, don't swallow it. Repeat this 2 to 3 times a week. 12. Thyme essential oil. Thyme oil is effective in preventing the growth of disease-causing microorganisms in the mouth. According to a 2013 article in the European Journal of Dentistry. 13. Brushing. Brush your teeth for at least 2 minutes, at least twice a day. Use a soft bristled toothbrush to remove plaque and debris from your teeth and along the gum line. Depending on how vigorously you brush, a medium or hard bristled brush could damage your gums, root surface, and tooth enamel. 14. Flossing. According to the American Dental Association, ADA, flossing 1 time per day is an essential part of taking care of your teeth and gums. helping remove debris between teeth that can contribute to plaque buildup. Now, check out these 2 extra tips below to give you more ideas on how to cure gum disease at home.
Hello everybody, Andrea Majewski here with Dental and Mobile Hygiene. So have you ever been to the dentist or your dental hygienist and they are very stern with you because they're not happy with how the inside of your mouth looks? They might be kind of saying to you, hey, listen, things don't look so nice in there. You need to kick it up a notch. You need to start working hard because this isn't what we want to see. So there might be a lot of plaque, a lot of tartar. The gums might be bleeding a lot, and they might even tell you that you have gum disease, otherwise known as gingivitis. If the gum disease gets worse and starts to eat away at the bone supporting the teeth, then that is called periodontitis. So if you've ever heard those terms. Now, quite often when I see patients, they tell me like, yes, I've been told I have gingivitis, or I've been told I have periodontitis. But what do I do? How do I fix that? So they might have been told, but they didn't quite understand how they can make it better. Because the good thing about gum disease is it is completely reversible, meaning even if you have a bad case of it, it can be reversed. But how? The best thing to do, you guys, is the easiest, and that's to brush twice a day and make sure to floss once a day. Yes, nobody likes to floss. Nobody does, but that's the only way to get in between the teeth, and that's where gum disease starts. It starts in between the teeth, and then it starts to spread. So even if you think you are brushing amazing, you can't get everywhere. You need to get in between the teeth. So the best thing to do is to brush twice a day and to floss once a day. Now, as you start to do that though, if the gums are unhealthy, the gums will bleed a lot, but do not be concerned, because even think of a cut on your arm. You have to clean that out. It's going to hurt. It will probably bleed a lot, but you have to clean it out for it to get better. So your mouth and the gums is the same. Once you're getting things better, it might hurt, it might be uncomfortable, and the gums will bleed a lot. But give it a week, even 2 weeks if it's really, really bad, and there will be less pain. It will not be painful. It will not be sore after about 2 weeks. Everybody's different. And the gums will bleed less and less. They might still bleed a lot for a week or two, but then after that, it will become less and less and less, and then they won't bleed anymore. Healthy gums do not bleed. Now, if you're thinking, wow, like I'm way past that point, my mouth looks horrible, I don't know what to do, then the gum disease might be at a more advanced stage where it just takes longer to heal. So don't expect your teeth to be perfect or the gums to be perfect after 2 weeks. It might take a couple months. But as well, your toothbrush can only do so much. If it's been, let's just say, 2 years since your last cleaning, your toothbrush cannot get it all. Your dental hygienist needs to go underneath the gum line with their instruments and clean away the plaque and tartar from underneath the gum line. Because even if you're doing an amazing job above the gum line, all of that infection, for lack of a better word, is underneath the gum still, and that needs to be cleared away first for things to be perfectly healthy. So the best package is to make sure to get your teeth cleaned. Let the dental hygienist clean away everything perfectly first, so then you're off to a good start, and then keep up the hard work at home. Brush twice a day and make sure to floss every day. If your gum disease is more advanced, then I would probably also say to use a mouthwash every morning and every night. Listerine, in my opinion, is the best, only because it is antibacterial. There are some out there with no alcohol. I believe it's the purple Listerine, but that does help too if you can't stand that like burning alcohol sensation, right? And for a lot of people, the alcohol isn't even a good thing because it tends to make your tissues quite dry if you do not have a lot of saliva to begin with. But if you need help, if you have questions, just let me know. I am so happy to help. But just the main thing to take away from this is it's never too late. If you feel that your gums are horrible, or you're in a lot of pain, or things just hurt, or the gums bleed a lot, honestly, I've seen it all. I don't mind. I don't mind. That is what I love to do, is cleaning the teeth to get you back to the best state of health possible. Because if your mouth isn't healthy, then you're not healthy either. Your blood pressure is probably a lot higher than what it needs to be. There's just a lot of things involved. So you want a healthy mouth. And your dental hygienist is the first step in order to do that. So if you need your teeth cleaned, let me know. It is almost the end of the year. I come to you. Use up that insurance while you can. At a dental office, they tend to book up pretty quickly, especially the evenings, because that is prime time. If you need help, if you need your teeth cleaned, I am open. So please let me know, you guys. I am so happy to help. If you have questions, let me know. Thank you so much for watching, and I will see you guys very, very soon.
Hi, this is Gali Gofar. Thank you very much for joining me here today. Today I'm going to be talking about how to treat gum disease naturally. Gum disease, or as it is professionally known, periodontal disease, is an inflammatory condition affecting the tissues surrounding the teeth. The early stages of gum disease are called gingivitis, whereby the gums become red, swollen, and may bleed when they are touched. If this condition is allowed to deteriorate, it may become periodontitis, a more serious form of gum disease whereby the gums pull away from the tooth and bone tissue may be lost. In this case, the teeth may loosen or fall out. Gingivitis precedes periodontitis, but not every gingivitis case will progress to periodontitis. Bad breath is common in any form of periodontal disease, which is generally due to bacteria in the mouth infecting the tissue around the teeth. Gingivitis affects the gums, and periodontitis affects both the gums and the bone that supports the tooth. Although no cure has been found to treat periodontal disease, some may help decrease plaque buildup that precedes all types of periodontal disease. So here are 5 natural remedies that help promote healthy gums. The first one is neem. Neem is a plant found to possess antibacterial properties. A small study on neem and gum health published in the Journal of Traditional and Complementary Medicine in 2014 revealed that neem, when used as a mouthwash, was successful in reducing plaque and preventing gingivitis. Tea tree oil, according to a report from clinical microbiology reviews in 2006, found that tea tree oil can help in the treatment of gingivitis. Search for a toothpaste that contains this essential oil as an ingredient is very recommended. However, beware of using essential tea tree oil in its undiluted form as a treatment, since consuming it is toxic. The next food is cranberries. Research shows that cranberries may help prevent gum disease by stopping bacteria from sticking to your teeth. What's more, a preliminary study found in the Journal of Periodontal Research shows that ingredients found in cranberries can help treat periodontitis-related inflammation. You may consume cranberries as a fruit or in the form of a sugar-free cranberry juice to reap the benefits. The next nutrient is vitamin C. Vitamin C, there is evidence that shows vitamin C is important in protecting gum health. In a study from the Journal of Periodontology, researchers found that adults who consumed less vitamin C had a much greater risk of periodontal disease. Vitamin C can be found in foods like oranges, grapefruit, mango, kiwi, strawberries, papayas, red pepper, broccoli, cantaloupe, and Brussels sprouts. And if you are currently suffering from any form of periodontal disease, I recommend taking 1,000 milligrams of vitamin C as a supplement. This is very, very supportive of gum health. The next treatment is called oil pulling, a cure that has been long used in Ayurveda. It's known as oil pulling and includes the swishing of a teaspoon or tablespoon actually of oil, such as sesame or coconut oil, in your mouth for about 15 minutes. Evidence on oil pulling's positive effects are limited, but a few small studies, including a clinical trial from the Indian Journal of Dental Research, have shown that oil pulling can reduce plaque buildup and protect your gums against gingivitis. Now, additional advice besides brushing, flossing, and having your teeth cleaned at your dentist professionally on a regular basis that can help you maintain oral health is consuming food that is high in calcium and foods that are very rich in fiber, that you have to strongly bite them. These are very, very good for keeping your gums healthy. You also want to avoid beverages and foods that have high sugar content. Now, some lifestyle practices that can help you also improve your gum health include avoiding smoking, which can greatly increase your risk for developing gum disease. There is evidence that shows that also how you manage your stress levels will help prevent gingivitis, because both smoking and stress form free radicals that may cause harm to your gum tissue. Also, the toxins in cigarette smoke are very toxic to gum tissue. However, if you notice symptoms such as pain while eating, bleeding gums, or teeth sensitivity, it is important to consult with your dentist. So I hope you like this short video on gum disease and how you can treat it naturally. And if you did, please give it a thumbs up. Please also subscribe to my channel. I upload these kinds of videos on health and wellness about once a week. Also visit my website at thegorilladiet.com for much health and weight loss information, programs, books, and anything to help you move your life to a healthier place for you. Thank you very much for joining.
As a way of thanking you for watching this video to the end, I am going to share with you an excellent option for treating gum disease. They are capsules called Steel Bite Pro. This product is FDA approved, made from 23 selected plants, and best of all, they give excellent results in people suffering from gum disease or tooth decay. This product is perfect for those who are looking for a natural treatment, but do not have time to prepare it at home. Click on the link below and see how it works, as well as its excellent benefits. And, if you have comments or questions, please leave them in the comments section below this video.